Hi, my name is KendraDouglas, and my persuasive presentation is on fear-free veterinary care. Introduction. Many pets experience fear during veterinary exams and visits, which can lead to higher stress and resistance of the pet during the physical exam. This can also lead to a higher risk of inaccurate findings during the physical exam and or lab work. Fear-free care focuses on reducing that anxiety by creating a calmer and safer experience for those pets. What is fear-free? Fear-free reduces that anxiety, stress, and fear in the animals by focusing on the mental and emotional well-being of the pets, not just the physical health of them. It also uses gentle techniques such as less is more restraint and positive reinforcement such as treats and toys. The problem. Traditional vet visits can cause panic and shaking and even aggression in some pets. And some animals can even associate veterinary clinics with fear and discomfort, which makes the exams harder and far less effective. And like I mentioned prior, it can make the lab work also ineffective. Consequences of a non fear free veterinary clinic. Pet owners might delay the care of their pet or avoid bringing their pet into the vet at all. New studies show that pets should be going to the vet biannually, so about every 6 months. If a pet is stressed, the owner might not bring their pet in every 6 months or even at that year mark, therefore creating health issues that go undetected. And if it is a known health issue, that health issue might go untreated. Another consequence is increased risk of injury to the veterinary staff. In order to be considered fear-free, you have to have a certification which trains the staff to recognize the stress signals in these pets. This certification is called fear-free, and it teaches better handling and communication with these animals. It also promotes a safer and more effective care for the practice itself. How it works. Fear-free uses treats, praise, and positive reinforcement to calm the animals. It also minimizes restraint by using less is more and gentle handling techniques. It also creates a quiet and comfortable environment for these pets. Benefits for pets. It reduces anxiety and fear during the exams, which encourages cooperation and even leads to better overall health outcomes. It does also benefit the staff by creating a safer working environment, which is done by reducing bites, scratches, and injuries. It also makes the exams and labs more efficient and accurate. It also benefits the owners because it causes less stress for the owners to bring their pets into the vet, but it also creates increased stress or increased trust in the veterinary professionals themselves, which leads to a more likely maintained regular veterinary visit schedule. A real life example of this is a nervous dog can come in and then they become calmer after treats and gentle handling. This creates this allows for that exam to be completed far more quickly and safely, along with more efficiently. Why it matters. Many people consider their pets their family, and there is a growing demand for that higher quality care for those family members. And Fear Free does meet these modern expectations. Why clinics should adopt it. It improves the reputation for the clinic or that specific veterinary professional themselves and client satisfaction. It also encourages repeat visits and loyalty among the clientele. It also provides a competitive advantage for either that vet clinic or that veterinarian professional themselves. Call to action. Veterinary clinics should adopt fear-free practices because of the benefits that I listed on the last one or last slide. And pet owners should choose those fear-free providers in order to make sure that their pet has a healthy life. It supports a better, more humane way of taking care of these animals overall. Conclusion. Fear-free care improves the experience for pets, owners, and the staff. It also reduces the stress and increases the quality of care that the pet is receiving. In turn, that does actually create a higher quality of life. It should become standard in veterinary medicine as a whole. My references that I used was the organization, the American Veterinary Medical Association, and American Animal Hospital Association. Thank you.